All right, the initial task of flattening the curve of the coronavirus looks to be moving to the rearview mirror. We've flattened the curve. We've made sure that we have the capacity in our healthcare facilities, and now more and more states are reopening. Today's Senate hearing entitled COVID-19 Safely Getting Back to Work and School has a lot of people still asking, all right, what are the next steps? Well, joining me now to provide some insight into that question and today's hearing is Senator Mike Braun of Indiana, who serves as a member of the Health, Education, Labor, and Pensions Committee. Senator, welcome back to Washington Watch.
Hey, great to be on the show.
All right, Senator, other than this being kind of a strange hearing where you had several people testifying by video and people in the room wearing masks and the public not allowed in, what was your major takeaway from today's hearing?
Well, I think you've heard most recently just a litany of testing. So I was real proud of my staff to dig into that to see were there any glitches? And, of course, it all gets blamed upon the White House. And out of the gate early, part of the reason I ran was to try to reform health care. We had 80 senators jump in with an idea to do that of a broken health care industry that never embraced telemedicine. None of the reforms that they need to embrace to lower their costs to make things more transparent. Of course, we won't get back to that until this is in the rearview mirror. But early on, and it started, I think, January 24th or so, that is when, between the CDC and the FDA, testing was thwarted simply because the CDC didn't want to look at the South Korean test. They wanted to do their own. Well, that one didn't work. And it was in early March by the time those two agencies kind of got their signals straight and basically gave the pharmaceutical industry and universities and the places that, in talking to several CEOs that run some of the pharmaceutical companies, they were chomping at the bits to do the testing, the therapeutics, and the vaccine. And I just thought it was not fair to constantly blame all that on the administration. He was dealing with the same thing that's beset healthcare for decades. An industry that's not quick on its feet in general, and agencies that oftentimes aid and abet, that issue. So that gave me a little glimmer of hope now that that's out of the way. And when you're talking about like AstraZeneca and Oxford University, 1 million doses of a vaccine available in September, a lot different than the year to year and a half that was commonplace just a month and a half ago.
Yeah, I would actually say, Senator, when you look at that fact, what you laid out, which is not just in the healthcare field in government, it's pretty much systemic through government. Yep. That it is resistant to change, it's slow to move. I would suggest, looking at the numbers, that it was President Trump's leadership that broke through, leveraging the power of the private sector to accelerate this research and develop these innovative diagnostic tests. I mean, you look what the administration's done, $11 billion to the states to help testing. I mean, it's almost setting up competition of seeing who can do it best, which is, it's a free market concept. Tends to work. It's worked for quite well for America. And then you look at the fact that, according to testimony in your committee today, by September, the U.S. will be able to produce and distribute and apply at least 40 to 50 million tests per month. That's pretty significant.
It is. And it also, when you listen to the people, the government doesn't make these tests. They should set the stage for it happening, and they actually thwarted it. And you talk to the people that are actually doing it, and pharmacy's got a lot of issues in terms of how they distribute their products, back to reforming healthcare. Right. They do a pretty good job in the lab with a very tricky dynamic that takes so many years of research. And I think due to the president knowing how entrepreneurs work, knowing how you're going to get quicker results, imagine had you had a president that was just going to be hand in hand with the FDA and CDC. we'd still be talking about getting out of the gate. So I think that's a difference. The fact that he takes a different style and approach to things does get him in trouble in some cases. Set him back here a couple of weeks ago when he, drifted at one of the hearings on, and a lot of that too. That's part of the style of being someone that looks at things differently. In this highly charged, heated environment, you get none of the benefits of that. You only get the negatives, and of course that's been the name of the game since he got elected back in 16. So this is different. It's created a great national anxiety. We've never seen it before. It has characteristics as a virus itself. Now we know that youth who have been totally passed over, there might be a small segment that might have a genetic predisposition that showed up recently. It's a tricky virus, but everything I am seeing